For millions of Kenyans, firewood and charcoal still remain the main source of cooking energy. But behind every meal cooked this way lies hidden costs, health risk, deforestation, and financial strains. In this eye-opening feature, we hear from families struggling to afford clean energy, health experts raising alarms, and policymakers pushing for sustainable solutions. What will it take for Kenya to achieve universal clean cooking by 2028?
In many homes across Kenya, the kitchen is the heart of daily life. Yet, for many, cooking comes with hidden dangers, posing serious health risks, damaging the environment, and straining finances. The transition to clean cooking is not just an option, it's a vital necessity. In the heart of Murang'a County, 60-year-old Mary Nyambura makes her way home, burdened not just by the firewood she carries, but by the daily struggle it represents.
I
would say we have no capacity to migrate to cleaner cooking. So I have resolved to cooking with firewood because I can't afford anything else.
Her humble homestead includes a simple house and a semi-modern kitchen, yet poor ventilation turns every meal into a health risk. Like many in her village, she depends on firewood and maize cobs, not out of preference, but because she has no other option.
If I moved away from the harmful effects of cooking with firewood, I would definitely benefit, because cooking with gas saves time, and I don't have to worry about the firewood getting rained on. I get chest congestion because of the smoke. I also have eye problems and I can't read small fonts.
Mary's story is just one of many. In rural Kenya, many families face the same challenge, relying on firewood and charcoal or struggling to afford cleaner alternatives. But what impact do these choices have on the wider community?
Medium usema kwangu yenye itatumika. Mfuko ikiwa haina ndoo ya kubuy gas, tunatumia kuni. Kama makaa nikienda kununua pale nitanunua ya 70. Inisaidie kupika. Inipikie chakula, inichamuzie maji ya kuoga nini yote. Gas nikienda pale ni labda lazima nikuwe na ngiri moja na 100.
As Paul points out, cost remains a significant barrier in the transition to clean cooking. However, community health promoters are working to shift mindsets and encourage cleaner cooking solutions, as British Wahu explains.
Some of the challenges are those people, the community always complain of chest pain, headache, sneezing all the time, and most of them are also affected to this disease called asthma. They're asthmatic. What we are doing, we are trying to educate those people, to create awareness to the community, to move from those dirty fuel using the firewood that may cause their respiratory system to be more challenging.
While awareness is increasing, policy remains key to driving change. How are the government and environmental agencies addressing this challenge? Julius Mwangi talks about the measures being put in place to guide the implementation of the Murang'a County Climate Change Act 2021.
You see, the issue of promotion of solar energy plus clean cooking came after we realized a lot of tree cutting is being done here. Those facilities, they use GCOs. They were using GCOs. So they have transformed from using GCOs, they are now using solar system to power their GCOs. The issue of installation of a solar system, that is purely done by the county. But when it comes to the issue of using clean energy, we are partnering with some of the organization, private sector like GTZ, and they are distributing the clean GCOs at a price that is low.
With climate change policies in place, the focus now shifts to implementation. But government efforts alone aren't enough. Local leaders must also drive the change. Priska talks about the enforcement of the 2028 migration plan.
Yes, we are aware and we are really fighting towards that goal. For example, we are encouraging the community to plant as many trees as possible and to avoid cutting trees anyhow. In fact, we have a policy in our administration where you must request for tree cutting and you must tell where you are taking the trees to. The local administration, together with the National Police Service, Nyubakumi, and village elders, all of us are on the ground to ensure that we disseminate information from the lowest level to the highest level.
The transition to clean cooking demands policy reforms, financial investment, and community involvement. Stakeholders like John Makumi are already driving sustainable solutions forward.
Community Forest Association ikishirikiana na Kenya Forest Service wamekuwa na mpangilio wa kuhakikisha wakulima ambao wamezunguka msitu wetu wanapanda miti kwa wingi kwa mashamba yao ili kupunguza pressure ya kuingia kwa msitu. Vile vile tumeanza mpango wa kutafuta jiko ambayo hatumii makaa ama kuni mingi, ambayo ni tuko na energy saving jikos na inapunguza sana sana upikaji wa kuni kwa wingi. Unapata kama mtu alikuwa anapika na kuni kama kilo 10 kwa wiki, anapunguziwa, anapika na less than 5. Vile vile kuna njia zingine ambazo tumeweza kuintroduce. Kumekuwa na watu wa biogas ambao wamekuwa wakisaidia, isipokuwa kwa njia kidogo sana, hawajakuwa wengi, biogas, ili kupunguza pia pressure ya ukataji wa miti.
How can Kenya shift to clean cooking while ensuring that those who rely on traditional fuels for income are not left behind? David's concerns shed light on this issue.
Sisi tutaumia kama wachomaji makaa. Juu sasa hii ndio tegemeo yetu ya kuchoma makaa. Shida ya makaa iko ya kiafya kwa sababu ukichoma makaa hiyo moshi inakuingia kwa kifua. Kwa hivyo ukikaa ukichoma unaanza kukohoa. Inaleta hiyo ugonjwa ya kukohoa, unafungika kifua ndani juu ya moshi. Sasa kama ile kazi inaweza fanya tu ni kulima. Kulima. Juu huwezi toka hapa sasa tena huwezi enda kwa ofisi.
Policy reforms, financial support, and behavior change initiatives must work together. But how does this transition align with Africa's broader energy landscape?
It's a needed transition, not just in the sense of mitigation, but also in the sense of preventing some of the respiratory diseases that are linked to some of these other methods that are not considered clean. The methods that we are currently using that are considered unclean, for example, firewood, are deeply rooted within some of the cultures that use them. Yeah, it's known that people like to sit around the fire as it's burning to maybe exchange stories and whatnot. And I'll give a very personal example. For example, my mother, despite trying to buy for her clean cooking stoves and gas, she still will light her fire because culturally that is what she knows. And so behavior change that is deeply rooted within culture can sometimes be quite hard to shift from. Additionally, I think unless we address some of the other areas around poverty, around lifting people up economically, again, it's going to be quite hard to maintain some of these clean cooking sources that you might give to the people for free. So they still need to maintain and buy the energy. And to be honest, in the country, it's considered a bit more expensive other than some of these non-clean cooking energy sources, right? Again, policy we need to have policy around clean cooking sources that allows it to be quite easy. We don't need to have a lot of red tape within the government for people to bring in or for people to access some of these clean cooking sources. Yeah, I think it's quite hard to import or to even create some of these things and distribute them to communities. And so the government can make it quite easy to avoid the challenges around bureaucracy for people to access some of these clean cooking sources.
Moving towards clean cooking requires policy reforms, financial support, and community participation. Stakeholders are already taking action to make it a reality.
As a country, we still have a huge population that is still relying on this producing fuel, and that one we are talking of 76% of the entire country using firewood and charcoal, and then we are talking of over 99% of schools still using biomass. What does this translate to in terms of disease burden? As a country, based on the report that was released last year in 2024, the State of Global Air, we are losing a total of 26,300 every year. And these numbers keep on increasing because it has been a trend. Back in 2016, we were losing close to 16,000. In 2019, the numbers increased to 23,000. Now we are talking of 26. We can see a pattern that those we are talking of deaths. And the most affected are mostly the women and the children. Kenya had made commitments to transition institutions, all institutions to clean energy by 2025. And all the households by 2028. And I'm happy with the development of the Kenya National Clean Cooking Transition Strategy, which was launched last year. This one already has created a roadmap showing that already the government has set up a way in which, if well implemented, then we can guarantee by 2028 we'll have transition all the households within the country. But we are still lagging behind because as of now, only 26% of the households have transitioned so far.
The transition to clean energy is essential for health, sustainability, and a better future. With policy reforms, financial supports, and community involvement, we can make a better Kenya. Clean cooking is more than energy. It's about lives, livelihood, and a lasting change. The time to act is now. For KEMRI Graduate School and Willow Health Media, my name is Susan Maina.